If the patient takes responsibility for their own actions and stays compliant through the full rehab cycle, they're going to be pain-free and not have any reoccurrences. Patients come to us because they're in pain, and the pain is causing them a limitation. We get them out of pain, that's the acute phase. And that subacute phase basically is getting them moving again and getting their joints more flexible, getting them freer to do things a little bit with less pain. Third phase is we then start strengthening them. And lastly, get them into a functional phase, and that includes them moving back into sports, work, house chores, yard work, all that stuff to make sure that they don't re-injure themselves. That's the prevention, and that's the key. So their whole rehab cycle is so important, and if the patient stays compliant, makes it through the full rehab cycle, pain-free lifestyle.
I can't imagine that I would be where I am today had I not done exactly what they told me to do and come as many times as they told me to come and, continued this therapy.
You have to go through the whole therapy because it's not just feeling better on a temporary basis. You've got to make sure what you're going through in your therapy is that it's a long-term, effect and that you're healing for the long term.
I did that a couple of times where I felt really good, so I stopped, and then it would come back.
I would say don't quit. I don't think you'll benefit from quitting. You need those extra appointments just to get to where you want to be.
Because I want to be to my full potential again, and I know that if I don't come, then I will never be where I was.
You have to go the distance, because if you don't, you're going to just step backwards. I mean, you have to have all the treatments to get yourself better.
PROCare.
PROCare.
Get better.
Get better.
Faster.
Faster.